everyone, hope you're all doing good. This is the second part of contraception where we are going to discuss all about the hormonal contraceptive methods, which will be including your pills. Yes, let us go. Contraception part 2. We are going to discuss about hormonal contraception, which is otherwise steroidal contraceptives. Okay. So, what are the routes of administration of hormonal contraception? Okay. And what are the available drug forms we have? Okay. So, first one is oral route. We can give combined oral contraceptive pills. Okay, combined oral means which will be combining only two hormones in action, right? Here, either your estrogen hormone or your progesterone hormone. So, combined oral contraceptive pills means we'll be introducing estrogen and progesterone combiningly. Okay, or it can be progesterone only pills. Okay, because considering the side effects of estrogen, will be removing estrogen and will be providing only the progesterone hormone to the woman. Okay, depending upon her health risk. Okay. And the second group is a injectable drug group where we will have DMPA or NETIN. Okay, so I'll discuss about this when it comes. And third group is implants, that is subdermal implants, which will include your Norplant, Implanon or Nexplanon. Okay, and the fourth group is transdermal patch. Okay, that is combined ethinyl estradiol and norgestromine. Okay, fifth one is intrauterine device, which is having the drug levonorgestrel, and vaginal ring, which will be NuvaRing, which is a combined ring. Okay. Now here we are going to discuss about pills. Okay, all about the pills. Okay. So first one is combined oral contraceptive pills. Okay. So this consists of estrogen and progestin. Okay. So the forms in which estrogen can be used include your ethinyl estradiol. Okay, this is mostly used, and then we can use estradiol valerate. Okay, and then progestins are nothing but the artificially made progesterones. Okay, so these are artificially made, and the structure is different from progesterone. Okay, different from progesterone. Okay, so if you take progestins, we have 4 generations of progestins. So what are the 4 generations of progestins we have? Number 1 is a first generation progestin, where we have norethindrel, then we have norethindrone acetate. Number 3 is ethanodiol diacetate. Okay, it is norethindrel, norethindrone acetate and ethanodiol diacetate. Second generation of progestins included levonorgestrel, then norgestrel, then norethistérone. Okay. Third group or third generation of drugs includes your desogestrel, gestodine and norgestimate. Okay. And finally, the fourth generation, we have dinogest, drospirenone, nestoron, then nomegestrel acetate, trimegestone. Okay. So these are the fourth generation progesterone. Now, what is the significance of newer generations? Why so many generations of drugs were found? Significance of the newer generations is that there is less androgenic effects of progesterone, okay, as the newer generations are found. Okay, so that means the fourth generation progesterones have the least androgen activity. Okay. Now coming to estrogens. Estrogens, I already told you it is mostly ethinyl estradiol. Okay, so this is mostly used. So based upon the dose of this ethinyl estradiol, the combined oral contraceptive pills are divided into high dose pills, low dose pills and very low dose. Okay. So high dose pills means the dose of ethinyl estradiol will be more than 50 micrograms. Low dose pills means the dose will be anywhere up to 30 micrograms, and very low dose pills means the dose is less than 20 micrograms. Okay, and the lowest dose of ethinyl estradiol that has been approved is up to 10 micrograms. Okay, right. Now let's discuss about the pills. Okay, so what are the different types of pills we have? We have monophasic pills. Okay, that means it will be containing the same amount of estrogen. Okay, it contains the same amount of estrogen as well as progesterone in one pill. Okay, and then the dose is also consistent. Okay, second group is biphasic pills, where during the first half of cycle, okay, the progesterone and estrogen ratio is lower. Okay, so that, and also remember, during the second half of cycle, the progesterone estrogen ratio tends to be in a higher side. Okay, so that means how we are giving this drug? In first 7 to 10 days, pills are of one strength. Okay, and they are given one color. Okay, and in the next days, that is 11 to 14 days, during the period of ovulation, there is a high period of fertility, pills are of another strength. Pills are of another strength, and it will be in another color. Okay, and then we have the last 7 days of the cycle where the pills are just a placebo pills or they are mere iron supplements. Clear? So, this is about the combined oral contraceptive pills. Okay. Next one is triphasic pills. Okay. So, triphasic pills means you have 3 different hormones here. Okay. You have 3 different hormones here. So, depending upon the band, okay, either estrogen or progestin can increase. Okay. So, here the first few pills are of one strength and one color. The second phase of pills are of another strength and another color. Okay. And finally, the final phase of pills or the third phase of pills are different strength and color. And apart from this, the last 7 days, you will be added the placebo pills, that is the iron pills as well. Clear? Right. Now, coming to the mechanism of action. So, mechanism of action is usually central action. Okay. Central action only we have, okay, with pills. So, what's going to happen is the estrogen and progesterone you give is going to inhibit the GnRH and it is going to inhibit the gonadotropins, follicle stimulating hormone as well as the luteinizing hormone, and hence the ovulation is also not going to happen. Clear? That's it. And also you have some peripheral action for the pills. So, peripheral action means the progesterone component, okay, progesterone component is going to prevent implantation and this makes the endometrium atrophic and hostile. Clear? And the next one is cervical mucus. Okay, cervical mucus is going to become thicker. Which hormone is going to act for this? Yes, it is the progesterone hormone. Clear? And the next one is tubal motility is reduced by the effect of progesterones again. Clear? Right. Now, when to start a pill? Okay, so starting a pill. Okay, it depends upon the condition of the woman. Let's take if she is a normal, non-pubertal or non-post-abortal woman. Okay, so in this condition, you have to ideally start the contraceptive on the first day of the cycle. It can be started on any day, but especially within the first 5 days. Okay, so during this first 5 days, no backup is also needed. Clear? And then something called as quick start can also be done. Okay, that means quick start means that is immediately after giving the prescription. Okay, at any day of the period. Okay, So this is also another option that this category of women can get. And before giving the contraceptives on a quick start basis, you have to definitely exclude pregnancy. Clear? Yes. And the second category of women is puerperal or post-abortal women. Okay, puerperal or post-abortal women means, let's take puerperal women in whom the combined oral contraceptive pills are started after 6 months. Okay, if especially the exclusive breastfeeding is done. Okay, some books mention it as 3 months also. Okay, but ideally after 3 months we can start, and it will be 3 weeks in non-lactating or women who are giving supplementary feeds as well. Okay, then suppose if she has undergone an MTP, then in that case the contraception should be started 7 days after evacuation. Okay, fine. Now let us see something important about the pills. Okay, so if we take pills are available in various strips. Okay, say a 28 days strip. This is Mala N. Okay, so this is the one which is the Government of India is supplying for free. Okay, so this pill is having hormones, that is hormone containing pills for 21 days, and then it has non-hormone containing tablets for 7 days, which means it is nothing but iron. And then there is no tablet free day in this type of strip, and cycles usually come during the non-hormonal tablet period. Clear? And the next type of strip we have is a 21 days pack. Okay, so this will be your overall L, Novilon, Femilon, etc. Okay, so in this group, it should be started on first day of her menses and continued for 21 days, and there are 7 days which are tablet free. Okay, so that is free days, and during this free days period only bleeding occurs. Okay, clear. Next one, let us see about the non-contraceptive benefits. When you take combined oral contraceptive pills, menstrual bleeding will become less, menstrual cycles become regular. This reduces dysmenorrhea as well, both primary or secondary. Then there is reduction in the pelvic inflammatory disease, that is caused by the spread of bacteria from the cervix, and it reduces the risk of acute salpingitis. Okay, it reduces the risk of ectopic pregnancy, hirsutism and acne is improved by taking combined oral pills. Then if you give it in the premenopausal age group women, the vasomotor symptoms are also reduced, bone mineral density is increased, it reduces the benign breast disease, it reduces the risk of new ovarian cyst as well as the occurrence of neoplasia. Then it reduces endometrial carcinoma to half to 1/10 also. Okay, as well as it reduces the risk of ovarian carcinoma and colorectal cancer. Okay, so these are the non-contraceptive benefits. And next one is side effects. Side effects will include nausea, vomiting, excessive white discharge, vulvovaginitis, there is breakthrough bleeding, spotting or amenorrhea. Then there is increase in weight gain because of the fluid retention, and there can also be facial pigmentation when you take these pills, that is known as cholasma. Okay, and there can be mastalgia, headache or dizziness, mood swings, depression and loss of libido as well. Okay, and some other higher risks include thromboembolism, okay, which is mostly due to estrogen, which is increased up to 3 to 5 times. Okay, and there can be myocardial infarction as well, especially in women who are smoke and already have systemic hypertension. Then there is a risk of stroke as well, there is a risk of hypertension as well. It is 1% risk, okay, it is 1% risk in a combined oral contraceptive pills uses, and there is a risk of gallbladder disease as well. Clear? Right. Next one is, remember, neoplastic disease risk is also there. That is breast cancer if age is more than 40, okay, and there is family history, then the chance is more higher. And the chance of cervical dysplasia and cancer rates are increased with increased duration of use. Okay. Now, let us see some contraindications where you cannot use this pills. Okay. So, contraindications will include active liver disease, liver cirrhosis, adenoma, carcinoma. Then there is a history of thromboembolic disorder, myocardial infarction, there is uncontrolled hypertension, diabetes with vascular complications, or there is a migraine, or a woman who's aged more than 35 years and especially who has a smoking history. Okay, then already known carcinoma patients, carcinoma breast or endometrial cancer, when she is also having undiagnosed vaginal bleeding. Okay, we didn't yet find out why the vaginal bleeding is happening. So in this women also, this is contraindicated, and who have breastfeeding and they are in the first 6 months of breastfeeding especially, and who have a history of prolonged immobilization, that means post-op patients. So in all these patients, combined oral contraceptive pills usage is restricted. Okay, now coming to management of missing pill. Okay, management of missing pill. The first category is they have missed 1 or 2 pills. Okay, that means you have to ask them to take the next pill, that is 1 pill to be taken as soon as possible, or 2 pills at a scheduled time. Okay, so scheduled time means previously at what time the patient was taking the pills. For example, pills should be taken regularly at one specific period. Say she is taking pill daily around 7 p.m. Then the same 7 p.m. she has to take the pills. She has missed the pill on Sunday alone. Then Monday she remembers that she didn't take Sunday. She can take the pill immediately, and again her Monday pill can be taken at 7 p.m. Suppose she has missed her 2 days pills, say Sunday and Monday. Then she can take her pills together on Tuesday 7 p.m. Clear? Second one is where she has missed 3 pills or more in the first week or second week. Here, 1 hormonal pill has to be taken as soon as possible, and second pill has to be continued as a scheduled pill. Okay, but what is important here is you have to use backup here. Okay, so backup is needed for the next 7 days, or otherwise you can directly advise abstinence. Clear? And if in the past 72 hours there is a history of intercourse, then you can even advise them to take emergency. Clear? The third category is where they have missed 3 or more pills in the third week. Okay, so here again 1 pill has to be taken as soon as possible, and all other hormonal pills, okay, all the other hormonal pills are taken as scheduled, and a new pack is started next day. Okay. So here we can also use abstinence for next 7 days, and suppose there is contact during past 72 hours, then you have to advise them for emergency pills. Clear? Right. Next one is any non-hormonal pill is missing. Okay, that is if she has missed it in the last 7 days of the pills, that is non-hormonal pill, that is a placebo or iron tablet like that, right? So if that pill is missed, then missed non-hormonal pills is discarded. Okay, and continue to take tablet as usual, and a new pack is started the next day. Clear? So this is all about missing the pills. Okay, so we have seen in detail when we miss one pill or two pill or 3 pills. That 3 pill missing in the first week or second week, what you will do. If she had missed in the third week, what you will do, and if she has missed the placebo, what you will do. Okay, so this is all about missing the pills, right? Now there are some indications of stopping the pill also. Okay, she is continuously taking the pill and she is coming and telling you some complaints. Okay, so at that time, when you will stop the pill? So what are the indications of stopping the pill? Number 1, when she is desirous of pregnancy. Number 2, when she is going for surgery, any surgery is planned, then before 2 months itself, you have to stop these drugs. Number 3, she experiences sudden chest pain. Number 4, there is cough pain or recurrent cramps. Number 5, there is severe migraine and loss of vision. Number 6, there is sudden respiratory distress. Number 7, there is excessive weight gain. Number 8, there is any fainting attack or any vertigo symptoms. Number 9, if she has uncontrolled BP, okay, that is more than 160 by 100 millimeter mercury. Then if she has severe depression or unexplained convulsions. Okay, and finally when she has got jaundice or any symptoms of hepatitis, and she is already on prolonged immobilization for any surgery or any other chronic disease. Okay, so in these cases you have to stop the pill immediately. Okay, even if she is taking it regularly. Clear? Right. Now if you stop the pills, the fertility will return within 3 months. Okay, right. Next one is progesterone only pill. Okay, let's discuss about progesterone only pill now. So progesterone only pill is also known as mini pill. Obviously, it contains no estrogen, only progesterone or progesterone in the form of levonorgestrel or etonogestrel. Then you have mechanism of action as well. Okay, so mechanism of action, it makes cervical mucus thicker, it prevents entry of sperm, it prevents implantation as well by acting on the endometrium. Then finally, it inhibits ovulation. Okay. Now, what are the indications of using progesterone only pills? When you prefer not to use combined oral pills and use progesterone only pills. So, indications of progesterone only pills. So, it is best for breastfeeding women. Okay. Particularly for 6 months. Then old age women who's more than 35 years and women who's having diabetes, hypertension, then cardiovascular disease, migraine or cerebrovascular disease, then SLE, as well as in women who are smoking. Okay, so these are some of the indications of considering progesterone only pills. So breastfeeding women, especially in the first 6 months, old age women more than 35 years, women who have diabetes, hypertension, cerebrovascular disease, cardiovascular disease, migraine, SLE, and then who smoking, right? Then, so what is the timing for starting progesterone only pill? Okay, so if she is a lactating mother, then in the first 6 months, before 6 months, she can be started at any time on POP, started at any time. Okay, and during this period, no backup is needed. Suppose if she is breastfeeding for more than 6 months, then also it can be started any time. But here you need some backup method. Okay, like a condom, at least for the first 2 days. Clear? Right. Now, so let us divide this category and make it simple. Okay, so she is a lactating woman within 6 months or non-lactating woman within her 4 weeks. And here lactating woman more than 6 months and non-lactating more than 4 weeks. Okay, so that means here in the first category you can start progesterone only pills at any time. Okay, here backup method is not needed. Okay, but here you will give, here also you can start at any time. POP can be started at any time, but remember to give backup for at least the first 2 days. Okay, so this is the thing you have to know. Okay, so this is simple. Okay, next one. When the woman is having normal menstrual cycles and she is a non-pubertal women, the POP should be started within 5 days of her cycle. Okay. Then here there is no need for giving additional protection. Okay. Needed. Then here also you will give backup for first 2 days. Clear? Right. Next one is following miscarriage. What you will do? Okay. So immediately following miscarriage, no backup method is needed. Okay. No backup method is needed immediately following miscarriage. But after 7 days, you will give backup methods for the first 2 days. Clear? So what are the advantages of using progesterone only pills? Advantages, the only advantage we need is we want fertility as soon as we stop the pills. Yes, that advantage is here. So fertility returns immediately. Okay. Now here, one pill has to be taken every day at same time. Mucus changes does not persist after more than 24 hours. Okay. So that's why it has to be taken at the same time every day. Okay. Then compliance on time taking of the pill is important. Okay. To avoid failure. Okay. So compliance on taking the same time is very, very important to avoid failure. Clear? Right. Now, okay, here I want to discuss about centroman as well. Centroman is nothing but ormeloxifene, which is a selective estrogen receptor modulator. Okay, so this is the drug. This is sold as a Haley under Government of India. So it is a non-steroidal as well as non-hormonal oral contraceptive pill. It is developed by the Central Drug Research Institute, that is in the Lucknow city, in the name of Saheli. Okay. So other name by which the government supplies this drug is Chaya. Okay. So if you take this strip, there are 8 tablets in one pack, and one drug contains 30 milligram of ormeloxifene. This can be taken orally and it is taken twice a week for first 3 months. Then it is taken once a week. Okay. What is the mechanism of action of this drug? You have advantage of preventing implantation. Then it has anti-estrogenic action on uterus and breasts. There is no anti-ovulatory action, that should be understood. Okay. So if you see, this drug is relatively safe and it is contraindicated in the liver or renal disorders. Okay. So with this, we are completing the discussion on the hormonal contraceptives, especially the combined oral contraceptive pills, progesterone-only pills, and centromin. Okay. So until we meet at the next part of contraception, take care, happy learning, and keep going.